Hello everyone, Dr. Christine Smith here. So I have a wonderful guest for you guys, and apologies, I know we've hopped on a few times, we're just dealing with some tech glitches, gotta love tech. I'm gonna go ahead and invite him to join really quick. There we go. He'll hop on in just a second, but this is Dr. John Hughes, and he specializes in regenerative medicine for head injuries out of Basalt, Colorado. There we go. Okay, he should be hopping on in just a second. There we go. Yes.
This is me.
Hi, Dr. Hughes. How are you?
Very good. How are you?
I'm good, thank you. All right. So I was just telling people that you specialize in regenerative medicine for head injuries working out of Basalt, Colorado, and you founded the TBI, basically you founded TBI Therapy, which is a clinic that offers treatment for traumatic brain injury. And then I was also going to mention that you wrote this super cool book called Fifth World Medicine, which I want to touch on a little bit more at the end for people because I have been reading it and it's fantastic. And it's basically about the evolution of healthcare and how important it is to look at people as holistic beings. So we can touch more on that at the end. But I would love if you would tell us a little bit just like how you got into your field and how you got into treating like head injuries specifically, and what is it about it that you find as inspiring as you do. And then we can also talk about some of the really cool patient results that you've had.
Yeah, totally. Thanks so much for the introduction. Thanks to anybody that's watching this. Christine, you have an amazing following, so thanks for bringing me on. Gosh, where to begin? My father, I'm a traditional osteopathic doctor. If anybody knows about osteopathic medicine, its roots actually came out of actually Shawnee traditions of manipulating the body, because years ago in the early 1900s, a guy named A.T. Still, Andrew Taylor Still, who was an MD, realized that, hey, if we manipulate the body in a very gentle way, we can actually affect the physiology of the body. Chiropractic philosophy actually came out of osteopathic philosophy, and they formed a whole school of thought about manual therapy helping the patients to get better in many different ways. So I'm a traditional osteopath and understanding the philosophy of osteopathic medicine and seek to kind of maintain those holistic roots in all that I do. And my main goal is to help patients, many patients avoid surgeries, unnecessary surgeries, and unnecessary pharmaceutical medications. Just fun fact, you're actually 10 times more likely to die of a pharmaceutical medication than you are a street drug. Not that you should use street drugs or psychoactive drugs necessarily, in a fun way, but they're much less dangerous in some ways. I'm not talking about cocaine or other drugs, but there's many dangers to pharmaceutical medications that we have forgotten about in our roots as osteopaths or any kind of holistic healers. Even the traditional MDs were much better about teaching patients about lifestyle and dietary changes. You look at the big Harrison Internal Medicine Guide to Medicine, it's full of, treating patients with diet and lifestyle changes before going down the path of the drug and pharmaceutical world. So anyway, in that world, in that way, I've tried to orchestrate how I treat patients in a regenerative way, using drugs only as necessary in a way that is helpful to patients, as only necessary.
I love that because it ties right back into the philosophy that you were talking about, right? Where it's like looking at the body as this incredible mechanism that is designed to heal itself. And so really, this is why I wanted to bring him on. And like, I've done another interview about regenerative medicine before. And for me, it completely changed my life and saved my knee after a knee injury where I was told by 10 different doctors that I had to reconstruct my knee, and I didn't want to do that. And regenerative medicine ended up allowing me to not do that and go back to being a pretty intense athlete. So like the results that you can get with this stuff is incredible, and it's just so impressive. So, and I know, like, how did you end up in this niche of treating head injuries with it? Like, it's such a cool approach to things.
Yeah, so my father, just back up a little bit, my father was a pretty holistic biological dentist. If anybody knows these types of dentists, my dad was taking out toxic mercury fillings back in the 70s. If you guys know about mercury fillings, when you look at a silver mercury filling, in somebody's mouth, it's 50% mercury. So if you ever played with mercury and a thermometer, somebody said not to do that, then it's probably a smart idea because mercury is more toxic than arsenic. So, he was very instrumental. I grew up, he was also a Weston Price dentist. Weston Price was a dentist who traveled around the world in the 1950s. He realized that people who lived close to the earth had less dental caries. And what he meant by that is eating much more foods closer to the source, higher mineral contents. These people, even though they were very primitive, had no food, no other resources except, very minimal subsistence lifestyles, were able to not have the diseases of modern culture. And I was very much influenced by that. And my dad has a lot of innovative people. I grew up listening to people like Deepak Chopra, Norman Cousins, Bernie Siegel, all these great thinkers about, hey, how do we do medicine in a way that is maybe somewhat scientific, but not confined to just this kind of basic biomechanical model, which I think reductionistically medicine has become very much like, hey, let's fix this, this thing that's just like a car that needs to be, plugged in or something,
It's a
or,
little more complex
these
than
days,
that.
or, some kind of like, new part that it needs. And it's very minimally focused in a microscopic reductionistic way. And so just to kind of go down that path, my dad told me in 2000, early to mid 2000s, he said, hey, there's a way to treat Alzheimer and neurologically injured patients using intranasal insulin. These are big studies that have been done at University of Pennsylvania, NIH-funded studies. And he said, you can place the insulin directly into the nose as long as you get it into the top part of the nose. It'll travel along the olfactory nerve channels into the cribriform fossa, into the cerebral spinal fluid, and diffuse all around the brain. And I was like, well, that's cool, that's great. I don't really treat anybody right now like that right now, even though my first wife did have some neurological issues. So I was just kind of curious about it I also, I was kind of mixing the disciplines together. I was also kind of an expert in learning about hyperbaric medicine, how that could help traumatic brain injury patients. So in 2013, I had a patient came all the way from Boulder, Colorado, and he said, hey, what can you do for me, John? Because I've had hyperbaric medicine, it's helpful, and we've seen numerous studies over the past years. It'll probably never be approved by insurance company because any insurance company, unless it's auto insurance, for example, maybe some kind of government, but insurance, but it's way too expensive in the insurance model as it is now to treat every brain injury patient that's out there. But I knew about it, and I knew that patients would come off label to do these treatments. And I had a patient who did 25 treatments. He's like, John, what else can you do for me? I said, hey, why don't we put some insulin in your brain? And at that time, I'm also been doing a lot of sports medicine. So I said, hey, let's combine the insulin with some of your growth factors from your plasma and see if that helps the patient. It
And
helps
for
you as well.
those who don't know, insulin has effects like growth factors. So I think that's why it can be helpful. And please correct me on the physiology. I'd love to hear more about the physiology of how that works, but that would be, I'm assuming, why you're using that for that treatment.
Yeah, insulin is a pro, anabolic type hormone. I
Right.
mean, and it's helpful primarily, and we think of people with diabetes not having enough insulin, or maybe even type 2 diabetes, they have insulin resistance because,
Mm-hmm.
and why do they get that? Because they have spikes in their blood sugar, their body has way too much insulin. And then what insulin does is it allows you to add nutrients to your tissues, right? So it's taking glucose across the cell membrane into your tissues. And if you don't burn that, if your mitochondria aren't spinning well inside the cells of those tissues, then like muscle tissues, for example, if they're not really working, the tissues have to put that, that nutrient, that energy somewhere, that glucose, and it turns to fat. And so what happens, you get more and more fat, you start getting insulin resistance, and then you have problems with actually managing your blood sugar because your body's not able to kind of produce the insulin it needs to actually take care of. Well, some people say that Alzheimer's, even traumatic brain injury, could be called diabetes of the brain. So when you have a brain injury, you end up in a metabolic crisis, and and even a hypermetabolic crisis, the brain goes into like all these, it's like a bomb has exploded and the brain's trying to put everything back together. It's like
Yep.
there's a lab experiment going on in every part of your brain. And
Yeah.
if there's a bomb that goes off, well, you got to put those pieces of that experiment back together, and it takes a lot of work to do that. Well, do work in the brain. There's really smart neurons that can help, but you got to have the energy to do that. And the problem with many brain injuries is that the brain just doesn't have the right way to kind of channel that energy, and it's trying to fix itself as well as trying to heal itself, and trying to heal itself as well as trying to function. And if you can't do both of those because you only have so much energy, then you need something to kind of accelerate the use of your energy inside your cell, and that's where the mitochondria live. So
That
hope that wasn't
so
too complex.
or no, I love that. I just want to like help people along with some of the physiology stuff. So basically, if I understood that right, you're saying that you're using insulin almost to help with energy for healing in addition to the pro-inflammatory factors that you might use in some of the regenerative medicine. And for those unfamiliar with regenerative medicine, there's like a couple tiers and levels of what you can do with it. And it kind of starts with like, you stimulate some inflammation, which is like sending signals to the body of, hey, please come here, heal here. And then the next level would be to use something maybe called PRP, which is like delivering both the signal of, hey, please come heal here, and the building blocks to do that. And then the next level would be like using some of your body's own stem cells. But there are doctors like Dr. Hughes who do like proprietary blends, which is where they very specifically pick the molecules that they're using to have a very specific effect. So he's kind of talking about mixing the signals of, hey, please come heal here, with also providing energy for that process. Is that about correct?
Yeah, I mean, and I think that's what's necessary is, it's kind of like if you were to fix somebody's house and you had all the parts there, but you didn't have or maybe you had all the parts and the workers there, but you didn't give the workers any food, they'd get a little tired and worn out at the end of the day. So insulin's like, it's kind of like it's like a fuel injection, or it's like a special way of getting that food. It's like the food truck, getting that food to the workers who need to do the
Perfect.
work.
Love it.
So, and I think that's the really simple way to kind of describe, when you have a brain injury, you need a little more extra food to make it work. Now, people talk about, and we put regularly, this is another kind of aspect, we regularly put patients on a ketogenic or a low glycemic diet. So you think, okay, well, why are you doing a low glycemic diet along with trying to give your brain more sugar, right? So how does that make sense? Well, hands down, people talk about your brain burning ketones, all that stuff. Most people, almost everybody burns glucose in their brain, and they've done studies. You take a test, for example, you drink a glass of lemonade or some fruit juice, and you do better on the test. The more glucose you have in your brain, the generally better. As long as you don't go down the path of doing too much unrestricted glucose, because that will create what's called oxidative stress, more neuroexcitatory neurotransmitters like glutamate, and less of the GABA that we might call as a neurotransmitter that calms you down. So it's good to have glucose in your brain, but we modulate that with the appropriate cofactors. We don't want glucose just running around creating all this oxidative stress. And you can have oxidative stress from chemicals in the air, stuff you breathe, but the biggest source of oxidative stress is your own mitochondria doing their work. And if they're not working appropriately or being controlled, so back to the house analogy, you got to have a foreman also helping kind of manage those workers. You give them the glucose, and you don't want them just to like get out of hand. You got to give that foreman some energy too. So, there's a fine balance about how much glucose, how much oxygen you want to give the brain. Some people talk about sticking patients in hyperbaric chambers, and they just run everybody at a certain pressure. It's really important when patients that have traumatic brain injury, and this is part of the other treatment protocol, using hyperbaric chambers, is to not go too high or get too much oxidative pressure or oxidative stress in the brain. So, and that's a whole other topic of discussion. But
Oh, totally. We could do a whole nother one on that one day. But no, I love what you're saying, and the house analogy is great, right? Like a lot of what I do for these for this channel and for these lives is just educate people about how their bodies work. So thank you for sharing that. And then I'll bring you back to what we were talking about, where you were basically just saying how you got into this specific niche of regenerative medicine for traumatic brain injuries. And you said you were kind of starting with insulin, so I'd love if you'd continue on that.
Yeah, so insulin was the beginning, and I said, hey, instead of mixing insulin with normal saline, because you have to dilute it, insulin's very strong. It comes in a very small, 23 units is approximately what we use most of the time, 25 units at max. And we have to dilute that because that's only, 20 that's 0.2 cc's, 0.2 milliliters. So you have to dilute it to get into the top part of the nose appropriately. Instead of diluting it with like normal saline, you have to use about 10 cc's, about 5 cc's each nares. We started using the patient's own sterile plasma, which has, like we said, all these growth factors. So I was already playing around with the plasma anyway, because I treat whiplash, knee pain, like you've probably done with PRP, a lot of these other sports injuries. And I said, hey, if this is good for the body, it's probably good for the brain. So why not add it to the sterile mix and see what happens? To my knowledge, I was the first person to do that in the United States, of putting growth factors from the blood, which are basically platelet lysate growth factors, into the top part of the nose and dripping into the brain. So then we researched, hey, does this work? So that was really my step into regenerative medicine. We were already doing hyperbaric medicine in itself for traumatic brain injury, because where I work in Basalt is home to one of the 3 freestanding hyperbaric clinics in Colorado. I think there might be a 4th one now, but that's really what I mean by freestanding. Is a hyperbaric clinic that's not in a hospital. And so you might ask, why is not everybody doing this work? But like I said, it's not covered by insurance. It's not, it's not cheap to do, even though patients can get large benefits. Like I said, only insurance cooperatives and car insurance companies have paid for this. But we had people coming here because they really had bad brain injuries. And the guy that I was seeing in 2013, he couldn't sleep at all. He had noise canceling earphones, dark sunglasses because of his light and sound sensitivity. He was just debilitated, and he had no other choice but to figure out a way to make it work with hyperbaric. So that's where I've kind of jumped into it. As we know, hyperbaric medicine is regenerative medicine itself. Oxygen in itself is a growth hormone, growth factor promoter. What we know with some of the studies that have been done with hyperbaric medicine and even like blood-based stem cells itself, is every 2 hours at 2 atmospheres, you get double to triple the amount of floating stem cells in your blood. And what we know that after about 25 treatments, you get what's called angiogenesis. Those blood cells are actually making more blood cells and making new blood vessels, which can actually help the brain in itself. So that's why only doing 1 or 2 hyperbaric treatments isn't quite enough from a long-term regenerative perspective. So yeah, that's.
No, this is so cool. I love this, right? Because so many people don't even know that these treatments exist. And so this is why I do this stuff, is so that people can have exposure to it. And this is why you should do things like read his super cool book, Fifth World Medicine, where I'm sure he talks about, right now we're going into like some deep physiology, right? His book, if you decide to take a look at it, which I highly recommend, he has a link in his bio that you can click on to explore it. It's basically kind of about the evolution of medicine and seeing people as like these holistic creatures where, when one organ is malfunctioning, it's not really independently malfunctioning. It tends to affect your entire body. And so that was the thing that I mentioned in the reel I did the day before this, where it's like, when you have head injuries, all of the biochemical, like, just cacophony and catastrophe that kind of happens from that he was talking about also affects the rest of your body, things like your gut too. And then it can create like this downstream cascade that really creates a catch-22 where you get stuck in this inflammatory cycle because you have a head injury, and then it affects the integrity of your gut lining, and then you start to have food particles and bacteria leak through, and then your body goes on high alert and gets super inflamed. It's trying to take care of all these things while it's also trying to heal your head injury. Like, that's a lot for your body to handle. And this is why it's super important to be incredibly careful with your diet when you are healing from anything, but also specifically when you're doing these types of treatments. And that was a lesson I learned in my own body, is like, I did this regenerative treatment. It was great. It saved my knee, but also I started to have some inflammatory effects just because it's an injury. Like, you're inducing an inflammatory cascade that ultimately is healing you, but you have to provide the right building blocks in that process. And so then what he's talking about, and like some of the stuff that he does with head injuries and brain traumas and regenerative medicine, like it was funny, I actually sent a message to a friend of mine who has had a TBI, and I was like, hey, I think you'd enjoy this interview I'm doing. And I told her who it was, and she goes, oh, that was my doc. He like saved my life. He's amazing. So that was just funny. And I'd love if you talk a little bit about like what you did in her case. That, and I've known this person for a decade plus, and so it was really fascinating to me to like literally see changes in her personality after the treatment that she did with him. So I'd love if you'd talk a little bit about the cool stuff you guys did.
Yeah, totally. Speaking of the gut, for example, I just want to go back to that. What
Yes,
we
please.
know is that 60% of our neurons are in our gut. We think that we think with their noggin, but it's probably that we actually might be thinking with our gut instincts more often than we realize. So, keeping those gut flora and all the other, organisms that live down there in the gut, it's probably really important as far as our long-term mental and physical health. I mean, healthy, and I can't stress this enough, healthy body, healthy brain. And so many of us are living in our heads, and sometimes we forget about our bodies. You can't have a healthy brain without addressing and making sure that whole body is healthy too.
Yep.
So, and you need, what we know too about the probiotics in our gut, the gut flora, is they actually are responsible for taking the dietary proteins, tryptophan, for example, and some other things, and actually making serotonin, and passing it along to what I'm kind of happy and kind of an expert on, is they pass it along to the platelets. So it's very possible that I'm just taking platelets out of the people's body, and maybe it's not stem cells or growth factors, maybe it's just the serotonin that's on those platelets that we drip into the nose in a higher concentration, and that has a lot of effects. What we know too, and just for not to go down this path too far, but if you live at altitude, you actually have less serotonin in your bloodstream and in your body on a regular basis because you have less oxygen. Hyperbaric medicine, or oxygen itself, will increase the amount of serotonin very rapidly. If you give someone inhaled oxygen, their serotonin levels go up rapidly. And how that translates for brain health is people that live at sea level actually have a lot more serotonin in their blood, and they have a lot less suicide. So people in Colorado or high altitudes in general have 3 times the amount of sea level or suicides as patients living at the sea level. So
Oh, wow.
from a purely kind of brain health perspective in serotonin, it's really important to kind of look at how serotonin levels help you manage stress, depression, even traumatic brain levels. And that, and there's a danger. I mean, to go down this path a little more is, okay, let's just give everybody SSRIs, selective serotonin reuptake inhibitors. What does that do? It actually changes how your brain metabolizes serotonin. And they're actually contraindicated in traumatic brain injury because it can make those neurons and leave them immature. So they're not actually healthy. And when you maybe taper off or you forget to take those meds, patients can go down a very suicidal path very quick. So SSRIs that's one of my big things. Is let's avoid using those with anybody suspected of traumatic brain injuries. And the stats that I sent you, from the incidence reporting, even in the county we live in Pitkin County, there's about 32% of the population that has had at least one or more brain injury incidences in their life. So it's very significant. I think from a mental health perspective, until you rule out brain injury, you might just be, pissing in the wind, with all due respect, with all these psychoactive drugs, or even counseling, or even nutraceutical therapies. If you don't first address, hey, let's find out if this patient actually had a brain injury. So. I'm
Well,
sorry if I didn't go back
no,
to
I
your
actually
original.
I love this. This is why I do these casually, right? Is because then we flow and we get to address these cool little tangents and like there are so many natural ways to raise your serotonin, and people also forget that serotonin is like a huge component of sleep. And sleep is one of the most important things your body needs to heal. Like it's completely necessary. And so, and then like pharmaceuticals and stuff, they can also alter your gut biome, which then alters your natural serotonin production. And there's like this whole cascade that happens. So for natural ways to raise serotonin, yes, you can do things like he was talking about, like include more tryptophan in your diet. That's going to be things like turkey. Like you can just Google tryptophan foods. And then sometimes you can work with a practitioner to work more nutraceutically or with supplements or something like that. But like meditation, they have shown in studies that like one session of deep meditation can actually increase your dopamine and your serotonin by 50%, 50. And so like you can use natural ways to basically increase your neurotransmitters on their own. And I always ask about head injuries in my intake forms because it's such a huge thing. Like I was just talking the other day about a new patient that I had who's had migraines that are tied to food and she's not sure why. And then I found out 3 years ago she had a concussion and these symptoms have slowly been developing over time. So then when we come back to where we were talking about that like really cool patient that he ended up treating who literally had shifts in her personality, like the way that she explained it to me is she's like, oh, I just feel so much more like myself,
I,
like things aren't as reactive. And and she'd been healing for 10 years and this still had this effect on her. So I'd love if you
so
talk a little.
this
Yeah.
patient, we'll call her Mary.
Yes.
She was, I mean, she works in the natural nutraceutical industry. She's brilliant in everything that she had done. And so what's the point of doing, nutraceuticals? Well, if you think of the brain as an energy crisis, okay, what nutraceuticals are mostly B vitamins and minerals. They're cofactors for helping you make more ATP, helping you make your mitochondria spend more, make more ATP, and utilize that energy. So she was doing everything right. She had the she had the right kind of like,
Diet.
approach from the dietary and nutrient perspective. However, from a purely nutritional perspective, she was missing the most important nutrient in a brain injury. And not just most important nutrient for any of us is what? I mean, I'll just throw this out to you, Christine. What do you think is the most important nutrient for all of us? Um,
I mean, there is a lot of them, but I guess if we're talking about neurons specifically, like glucose is definitely necessary for them to function.
Glucose is up there, but like, let's just say like this: if you don't, if you don't, if you don't, if you hold your breath and you don't breathe for
Oh,
a
oxygen.
couple
There you
minutes,
go.
it's oxygen.
Yeah.
You can not eat for a week, you'll be okay. You can not eat, probably drink water for a few days, you'll probably be okay. So it's not water, it's not food. It's the most important nutrient for all of us is oxygen. Maybe some other things in the air, inert gases and things like that. This patient, she just wasn't getting enough oxygen. And why and one of the reasons, like, she didn't realize that her brain needed more oxygen. Her brain needed more oxygen because it's not like, and I've told this story multiple times, when you sprain your ankle, you rest on a couch for a few weeks and it starts to get better. You injure your brain, it never rests. Even while you're sleeping, you consume 20% of the oxygen and 25% of the glucose. And so your brain's like running, it's like walking on this sprained or broken ankle. So if you can't get that brain to rest, and even the best neurologists will tell patients, oh, go home and sleep and rest. Well, nobody's resting. Nobody's doing that. Even in a dark room meditating, you might be great in getting some more serotonin, but you're not really resting. And so in order for that sprained brain to heal, you need oxygen to fully heal. And I think, all these people, with all due respect, sometimes walking around in, these brain injury support groups or other things, they don't realize, hey, if I just got oxygen, what's the point of pressurized oxygen or hyperbaric oxygen? Well, what happens when you get hyperbaric oxygen is you dissolve that oxygen into your bloodstream, into your lymphatic tissues, into your cerebral spinal fluid, and it stays dissolved at a higher concentration for the next 24 to 48 hours. So you get this ability for your brain, some of its cells, to rest. I mean, to actually say, hey, I can rest and I can heal. And some of those cells can function and do their thing, but some of them can actually be like, okay, now I can focus on healing. And I feel like if I miss something in anything, or if anybody missed anything in how to treat a brain injury, it would be that. Because until you get that kind of fact, right, that the brain is in a metabolic crisis, an energy crisis, it needs more energy to heal as well as to function. And the best nutrient for healing is oxygen. Even if you breathe, I mean, you can breathe oxygen for an hour and you feel great, but breathing oxygen without having the pressure of oxygen won't keep it dissolved in a couple. So if you just breathe oxygen all day, carry an oxygen tank around with you, that's fine. But really, it's the pressurized oxygen that's going to allow you to help kind of live your life a little bit and start to heal and take that oxygen a little deeper into your tissues. So yeah, I mean, that's what we did with her, with that patient who had everything right, you know, from a nutritional dietary perspective. She had all these cofactors, and once we gave her the oxygen, she started responding right away. We upregulated some of the growth factors and stem cells, and we took her blood. We spun out those, you know, and this is, you know, FDA exempt process. We're not doing anything illegal. It's already all in the PRP. We spun out her growth factors and stem cells. And we dripped those in along with some nutrients, some antioxidants to protect her cells, and dripped that into her brain a couple of days in a row, and she felt pretty amazing. And she went from being suicidal and very stressed and kind of internalizing this to being a very happy person and turned on to life again. And that's, I mean, when you can be like, hey, wow, you know, I helped your knee injury, that's great. But when you can feel like somebody's on the planet, at least standing upright and walking around, and, you know, they have their identity back, it's pretty amazing. So, I mean, that's treating traumatic brain injury. I'm not saying that's the only way to treat traumatic brain injury. I think there's plenty of other ones, but that's been the simplest, most helpful regenerative way that we figured out to do this. And yeah, all that nutrition, I think that patient was amazingly primed for this. And so that's where I don't want to downplay any kind of diet or nutraceutical therapies, but none of that's as important as the oxygen therapies for this patient or anybody else. So.
Absolutely. Well, no, thank you so much. Like, I just, you know, stories and testimonials, like, that is the real proof of how well this stuff works. And I've seen a couple questions come in. Just so you guys know, this will be recorded, and you can check back into it if you want to hear details, because it wasn't really like one specific treatment. Like, it was a variety of things that he was talking about. So definitely go back and watch it, because he's listed a ton of good information here. So I know you're busy and it's already the evening, so thank you so much for taking the time to do this. There's kind of two things I'd like to end with. One of them is, like, what do you want people to know the most about caring for a head injury? Like, what do you think is the most important thing? And then I'd love it if you would tell us a little bit about your book, because I've just been really enjoying it. And just to give you guys like a taste, just like one of the things on the back cover is Fifth World Medicine satisfies humanity's deep collective hunger for lasting health as it integrates one's spirit, mind, body, and earth. If you feel this hunger, follow the wolf on this journey to the fifth world, a journey guaranteed to test your worldview and entire understanding of what is true. And so it's like, it's just, I love talking to people like yourself, because really it's the evolution of healthcare and caring for the whole being. So yeah, I'd love if you could touch on what you think the most important thing you want people to know about caring for their head injury is, and then touch a little bit about your book.
Well, the biggest thing to know is there's hope. You know, there's so many people, one, they may not know they have a brain injury. And that's, you know, maybe you're depressed, maybe, and you know, it's interesting just to throw this out there. People who don't get, military veterans, for example, who don't even get hit, sometimes just the PTSD, the psychological impact or emotional impact or the stress can create its own brain injury. So keep that in mind. It may not be officially, hey, I got hit in the head or there was a blast that went off, but you can have a brain injury and you can have the symptoms of that and still be just as neuropsychologically disabled as anybody that got hit with a bat or hit with a car or anything like that. So keep that in mind. I think investigating that, you know, we do have some clinics we work with that do what's called a WABI, QEEG, and we found that, and we also offer some cognitive testing through Cambridge Brain Sciences. It allows us to basically neurocognitively understand what's going on with the patients. There's a clinic in Louisville called Helios Clinic we work with. You can certainly call my office. Christine, you can give them that info if you want, and find out where you can get that testing. But tbitherapy.com, there's a questionnaire, and you can certainly do cognitive testing. I think that's a good way for anybody that has any kind of mental health or any kind of suspected brain injury from their history to first look at, hey, is this affecting my life? What's going on? What are my symptoms? Start looking at those symptoms. And classic symptoms of brain injury is to understand, hey, look, am I sensitive to light? Am I a little more irritable? Am I having headaches, memory loss? And this isn't, even if you're a certain age, it may not just be age. I'm not convinced that we all have to lose our memory when we get to be 100 years old or whatever.
I
I think you can
agree.
have as good a brain as possible. But any of these things, loss of concentration, attention deficits, outburst of violence, or anything like that could be related to a brain injury. So, and that's if you have any, as a loved one, try to be like, hey, let's sympathize with this person before we get in an argument with them. So start looking for that, and looking to see if you have a traumatic brain injury or any kind of chemical brain injury. It could be from a drug, could be from anything psychological, or metal fillings potentially in your mouth, whatever. So all of that, I think that's the most important thing, is find out if you do have a brain injury. And then there are some very simple, inexpensive therapies. There are home hyperbaric chambers you can use if necessary. And I think there's other simple things you can do. Even just going on a ketogenic diet can be very helpful. We work with a PhD nutritionist named Sasha Hope, who's very good at helping patients. And she'll do a free 15-minute consult with anybody. She's out of Louisville. I'm sure Christine has much knowledge on that as well already after talking with me. So yeah, I think learning how to manage that brain injury is very important. We have a few different supplements. Magnesium is very good if there's an acute brain injury. Tryptophan is good as long as you're not taking an SSRI drug, anything like Celexa or something like Paxil or anything like that. And then adrenal support is really important for a lot of our patients. So you can tell them more about that. But I think that's probably the most important is, hey, do you have a brain injury or someone a loved one? And then from the book, I think we forget that we are more than just minds and bodies, that we are spiritual beings. And the next world, which I feel like is the world that's coming to us as the techno-industrial world starts to decline. And we're seeing that happen now, that technology is not enough to just connect us to each other. And I think we'll learn how to connect with our bodies and our spirits and be better connected to the earth in a harmonious way. That is really the message of the book, is how do we start being, like I said, maybe thinking or being from our hearts and learning that, how to love. And ultimately, when we think about love, it's not just, hey, this is a nice feeling or somebody we're with, but what does loving look like in medicine? Does your medical doctor actually love you? And when they do, what happens is the consciousness is different. It's not just, hey, it's this patient-subject relationship. It's this oneness that I don't know about my patients. I know them. I have this intimacy and because of that, this intuitive understanding that goes way beyond simply a scientific lab result or something like that. Not that there isn't a place for all that, but it transcends reason and transcends even the basic, what I would call fourth world science, which is, the science that we all mostly depend on now is based in 17th century, looking at five senses and what we understand. I understand patients, and I would hope to understand them and the rest of the world in a magical way, and intuitive way, and maybe a divine way. Because ultimately, all my patients and everyone I interact with is just a divine, wild being. So we're integrated as wild animals and magical, beautiful, spiritual beings. So
Thank you. I think that is an incredible perspective to take on things. And to anyone who is new to that perspective, I highly encourage you to check out the book, because I kind of think in the same way. And when I work with clients, I work with them on mindfulness, and I work with them on how they're thinking about things. And I work with them in a deeper way where they can get in touch with their own energy. Like the motto I run my business by is reconnect to vitality. And I think people forget that we have this like energetic sense to us that is completely involved in every single form of healing. So it is really important. So anyway, if you want to check out more of what he was talking about, go to the link in his bio. You can just click on his account and then click on the link and it'll take you to all that information. And thank you so much for taking the time to do this evening. I think this is a huge topic, and I know kind of I didn't get as many questions as I thought. So, because I had people asking questions when I put the reel up the other day. So I'm going to post the recorded version of this. If anybody has questions, just comment and you can tag us and we'll see if we can answer your questions or direct you to the right place, because that's why I do these things, is just to help you find the right people and find the right information so that you can feel powerful in your own life and in your own healthcare rather than disempowered. So anyway, thank you so much for your time this evening. And any last words or anything?
Christine, you're awesome. Thank you so much, and for introducing everyone, and everybody. Thanks for attending, and hopefully this gives you guys, like I said, hope and peace about where to go for getting healing and long term like health and well being. So thank you.
Absolutely. Thank you. Have a great night.
Thanks a lot. Bye bye.